Hi, a very good evening to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. So, the One Health Initiative talks about the optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board NDDB in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out first varicella culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in anti-rabies vaccine segment and present in around 50 countries. Three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. While coming to our vision, mission and values, our vision is shaping global healthcare by spearheading the One Health initiative. While coming to our mission, it is to innovate, produce and market quality healthcare products and services to improve and extend the lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abharab in an eco-friendly pack. And with this, we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility and have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and totally revamped the facility and given private infrastructure to these government schools, and with our intervention the strength of these two schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutrition supplement to over 1600 school-going children of Telangana and Tamil Nadu. And as we know, we are into the field of rabies. We have tied up with FIAPO, Federation of Indian Animal Protection Organization, to make Thiruvananthapuram rabies free. You can visit our website www.indimmune.com. Our toll-free number is 1800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Insta as well as Twitter. And you can visit us at www.fearlessagainstrabies.com and www.pubertytomenopause.com. Now, to have our discussion today and to start on with the discussion on an very interesting topic called Bacterial Vaginosis Complications during pregnancy, we have an expert as well as a renowned gynecologist from Patiala, Dr. Madhvi. Welcome, Dr. Madhvi, to our show, We Talk to You. We welcome you wholeheartedly, Doctor.
Thank you. Thank you so much, Richa.
And with your permission, Dr. Madhvi, I would like to introduce you to our viewers as well.
Sure.
Dr. Madhvi Arora is a renowned gynecologist with over 15 years of experience. She did her fellowship in reproductive medicine from Gauri Hospital, Delhi. She is an ex consultant at RG Stone Urology and Laparoscopy Hospital at Delhi, then Rich Fertility and IVF Center Patiala, followed with Medicover Fertility Center Ludhiana, and presently Dr. Madhvi is consultant and head at Shri IVF Center Patiala. Dr. Madhvi is also a life member of Indian Fertility Society, FOXY, ISAR, and Society of Fetal Medicine. Welcome, Dr. Madhvi.
Thank you.
Dr. Madhvi, without wasting much of our time, I would request you to please let our viewers know why we chose this topic, bacterial vaginosis and complications during pregnancy.
Bacterial vaginosis is a very common problem with which patients come with very minimal symptoms many a times. The best thing is patients are aware about it and they don't land up with too many complications with that. But it is actually a which really needs to be considered as which needs a treatment. You should not just let it go. The basic problem, the basic symptoms patients have is like vaginal discharge or pain lower abdomen. So that bacterial vaginosis has to be ruled out and it has to be corrected before patient plans for a pregnancy or something. So if it increases during the pregnancy, that needs a treatment. So, and it's very easy for the patient to actually get bacterial vaginosis. So that's why it is a concern and it needs attention.
Right. So, Dr. Madhvi, how does bacterial vaginosis actually, affects the quality of life of a woman?
See, normal, first of all, we'll discuss what is, the normal vagina flora and vaginal pH. So, for a normal female, the vaginal flora has lactobacillus and anaerobic organisms, bacteria. So, these are the healthy bacteria which maintain the vaginal pH to an acidic level, which is between 3.8 to 4.4 values. Till 4.5, the vaginal pH is good enough. In case the pH increases, it means the growth of other unhealthy bad bacteria will start happening and patient will start having symptoms. So in that scenario, the unhealthy bacterial growth increases, which needs attention. And in that scenario, the bacterial vaginosis needs to be treated. Patient needs to be on antibiotics. Patient needs to be taking some mixed antibiotic, antifungal therapy to get it treated. Otherwise, in pregnancy also it can lead to further complications and it can affect you not getting pregnant. Basically, it can lead to infertility also. So it is a concern. It needs to be treated.
Right, Dr. Madhvi. Dr. Madhvi, as our today's topic of discussion is also this that bacterial vaginosis complications during pregnancy. So, we would like you to explain our viewers about the complications which may occur during pregnancy if a lady is suffering from bacterial vaginosis.
If a female is pregnant and if it's like first trimester, if patient has bacterial vaginosis, again she can have uterine contractions because of that, and she can have the cervical opening can also open up early before the time. Even in preterm labor, it can induce preterm labor, leading to ascending infection to the fetus also, and it can actually lead to premature rupture of membranes. So it patient might land up in an early abortion or a miscarriage or preterm labor. So it is a concern.
Okay. Dr. Madhvi, are there any chances that the newborn baby may also get infection if bacterial vaginosis is not treated, on time or at the earliest?
Yes, if but it is seen in rare scenarios, but yes, it is seen that if the patient has extreme variety of bacterial infection, bacterial vaginosis, the fetus also gets pneumonitis, meningitis, endocarditis also in that scenario. So patient needs the treatment as soon as she is diagnosed about it.
Dr. Madhvik, it is generally seen that whenever a lady goes through IVF treatment specifically, so there are so many chances or enhanced chances of getting bacterial vaginosis during the treatment. So, what do you suggest to couples when they are going for the IVF treatment or when they are starting the IVF treatment to just avoid or prevent bacterial vaginosis?
There are certain factors that first of all, I give them a course of antibiotics when we start with the IVF treatment. In case patient has that minimal bacterial vaginosis, it should get treated before we go for an IVF treatment. That should not be the reason for the failure of an IVF, first of all. And yes, we can tell them to restrict yourself to single partner, first of all, sexual contact. Then try to use condoms when you're going for intercourse, especially during the treatment, so that the infection is not transmitted to the other person. And no vaginal douching to be done. These are the basic things you can do to prevent bacterial vaginosis. And it's always better to give patients some vaginal probiotics and all to prevent them to further have that vaginal bacterial vaginosis.
Okay. Doctor, is there, any, I would say, apart from vaginal probiotics, does oral probiotics also help in, combating bacterial vaginosis, specifically those probiotics who are enriched in lactobacillus species?
Yes, again, it maintains the vaginal flora. So even I give those oral probiotics which take care of the vaginal hygiene and take care of the vaginal pH.
Dr. Madhvi, what tips and tricks you would, suggest to our viewers to so that they can just avoid getting into this zone, or if they are suffering also? So, do they take antibiotic and probiotic at the same time, or some difference should be there while they are consuming both, or any suggestions you would like to give?
First of all, like we discussed, what all we can do to prevent bacterial vaginosis. So, in case the patient is already suffering from bacterial vaginosis, patient would need antibacterial treatment, the oral antibiotics patient will need. And for the initial phase, we prescribe oral probiotics twice a day. And later, once this acute condition subsides, once the bacterial vaginosis is cured, after that, we continue those oral probiotics for another 15 days to around 2 weeks to 3 weeks, so that, the vaginal flora remains healthy and it doesn't get infected again.
Okay.
And again, maintaining the vaginal hygiene.
Right. Uh, Doctor, do you recommend the use of probiotics to stop the recurrence of bacterial vaginosis? Does this help in, subsiding the recurrence as well?
Yes, they do. We need to provide them with the oral probiotics at least once a day for total around 4 to 5 weeks. Patient needs to take, and that actually takes care of the vaginal recurrence. This one, bacterial vaginosis recurrence also.
Okay. Thank you so much, Dr. Madhvi, for giving your time, valuable time. Doctor, I will just see if any queries are there, so you can just reply back.
Sure.
Doctor, one of our viewers is asking that she is continuously having white discharge from the vagina and also having fever. Is she suffering from bacterial vaginosis?
Yes, could be combined with the some pelvic inflammatory disease also. So she needs to thoroughly get herself examined along with the some transvaginal ultrasound also. And then accordingly she needs a treatment. And we need to rule out some other causes also of the fever. The fever should not be big. I mean, we don't know right now that the fever is because of the bacterial vaginosis or some other reason also. So further other factors also need to be ruled out.
Okay. So she should she should consult one of the
Her own
gynecologists.
gynecologist, yeah.
Yes. Okay, doctor. One of our viewers is asking, doctor, that during my periods also, I get some white discharge, not only the red ones. So, am I also suffering from bacterial vaginosis? Maybe Dr. Pinkish discharge is also sometimes there.
Yeah. I
So,
feel when you're not on your periods and you feel your vaginal discharge has a foul smell or something, and the discharge is too much that to handle routinely. See, normal vaginal discharge is also hormonal based. So in case it stings, or
right.
the altered color and all that, in that scenario you need a treatment. Normal vaginal discharge does not need a treatment. Every vaginal discharge does not need a treatment.
Right. So, foul smell or some odor, if
Yeah,
it is
odor, smell, and color, all that matters.
right, right. So, doctor, one more query is there that I am 7 months pregnant, and till now I had no vaginal discharge, but now I see thin discharge coming out. Am I suffering from bacterial vaginosis?
You need to get yourself examined by your gynecologist.
Okay.
The kind of discharge the doctor has to rule out, what kind of a discharge is it. It's seven thin discharge, we should rule out premature rupture of membranes also. If it's a thick discharge, we know it's not water. But if thin discharge, sometimes there's a high leak. When there's a leakage from the upper part of the amniotic bag,
Yeah.
so that doesn't come out spontaneously. There's no sudden leakage. This slowly trickles down. So she needs to be examined.
Maybe a premature delivery or
Premature
something
rupture,
could
yeah,
be there. Okay. Thank you so much, Dr. Madhvi. These were the questions till now. Further, if we get any more queries, I will definitely get back to you.
sure.
So,
Anytime.
thank you so much, Dr. Madhvi from Human Biologicals Institute and Puberty to Menopause team. We
Thank you.
wholeheartedly thank you. And once again, on behalf of P2M, Women Health Awareness Initiative by Human Biologicals Institute, I wholeheartedly thank to all the viewers as well. And we request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life, and follow us on Facebook, Twitter, Insta to get more updates on health and live talks with the expert doctors across the nation. Till then, choose better health and choose happiness. Thank you. Thank you so much.